Question 1. Governance review demonstrates a need to enhance the EKG technician's proficiency in identifying congenital heart defects in pediatric patients. During a routine EKG on a 3-month-old infant, the tracing reveals a heart rate of 150 BPM, a QRS duration of 0.08 seconds, and a notable right axis deviation. Considering the potential for congenital heart anomalies, which of the following analytical approaches best aligns with the EKG technician's role and regulatory expectations for preliminary interpretation? Option A. Interpret the EKG as definitively showing a ventricular septal defect and recommend specific diagnostic imaging based on this interpretation. Option B. Focus solely on the heart rate being within the normal pediatric range and disregard the axis deviation as a less critical finding. Option C. Conclude that the right axis deviation is a normal variant for infants and proceed with routine documentation without further concern. Option D. Document the findings, including the right axis deviation, and flag them for immediate physician review. Recognizing this pattern can be indicative of certain congenital heart conditions requiring further investigation. The correct answer is D. Document the findings, including the right axis deviation, and flag them for immediate physician review. Recognizing this pattern can be indicative of certain congenital heart conditions requiring further investigation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of identifying congenital heart defects, CHD, in pediatric patients through EKG interpretation. Misinterpretation or delayed identification can lead to significant adverse health outcomes, including progressive cardiac damage, heart failure, and even mortality. The EKG technician's role is crucial in providing accurate data for diagnosis and management, necessitating a thorough understanding of how various CHDs manifest on an EKG, even in subtle or atypical presentations. The challenge lies in distinguishing normal pediatric EKG variations from true pathological findings indicative of a CHD, requiring a high degree of vigilance and specialized knowledge. Correct approach analysis. The correct approach involves systematically analyzing the EKG tracing for specific patterns associated with common congenital heart defects, such as atrial septal defects, ASD, ventricular septal defects, VSD, tetralogy of Fallot, and transposition of the great arteries. This includes evaluating P-wave morphology, PR interval, QRS duration and axis, SD segments, T-waves, and QT interval in the context of the patient's age and clinical presentation. For example, recognizing right axis deviation and a complete or incomplete right bundle branch block in a neonate might prompt further investigation for a VSD or ASD. Regulatory framework for EKG technicians, as outlined by CET guidelines, emphasizes accurate data acquisition and preliminary interpretation within the scope of practice, which includes recognizing deviations from normal that warrant physician review. This approach aligns with the ethical obligation to provide competent and precise patient care, ensuring that potential cardiac anomalies are flagged promptly for definitive diagnosis and treatment. Incorrect approaches analysis. One incorrect approach would be to dismiss any EKG findings that deviate from adult EKG norms without considering pediatric variations or specific CHD presentations. This fails to acknowledge the unique physiological differences in the pediatric heart and the characteristic EKG changes associated with CHDs. Ethically, this constitutes a failure to provide appropriate care due to a lack of specialized knowledge, potentially leading to delayed diagnosis and harm. Regulatory failure occurs by not adhering to the CET's expectation of understanding age-specific EKG interpretations. Another incorrect approach is to focus solely on identifying gross abnormalities and overlooking subtle but significant findings. For instance, a mild QT prolongation or subtle STT wave changes might be missed if the technician is only looking for overt arrhythmias or chamber enlargement. This approach is professionally deficient as it risks missing early signs of cardiac compromise or specific CHDs that may not present with dramatic EKG changes initially. It violates the principle of thoroughness in patient assessment and the regulatory requirement for comprehensive EKG analysis. A third incorrect approach is to attempt to provide a definitive diagnosis of a specific CHD based solely on the EKG. While EKG technicians are trained to recognize patterns suggestive of CHDs, the definitive diagnosis rests with a physician, often requiring further diagnostic modalities like echocardiography. Overstepping the scope of practice by diagnosing can lead to misdiagnosis, inappropriate treatment, and legal ramifications. This is a significant regulatory and ethical failure, as it undermines the established healthcare team structure and the technician's defined role. Professional reasoning. Professionals should approach EKG interpretation for suspected CHDs with a structured methodology. This involves first ensuring proper lead placement and artifact elimination. Then, systematically review all EKG parameters, comparing them against age-appropriate normal values and known EKG manifestations of common CHDs. Crucially, any deviation from expected findings, especially those suggestive of a CHD, must be documented meticulously and communicated promptly to the supervising physician. The decision-making process should always prioritize patient safety and adhere strictly to the established scope of practice for EKG technicians, recognizing when to escalate findings for further medical evaluation. Question 2. Examination of the data shows an EKG tracing with significant ST segment depression in leads V4, V6, and Roman 2, Roman 3, a VF. The patient has a known history of peripheral artery disease but denies any current chest pain or shortness of breath. Considering the patient's vascular history, what is the most appropriate interpretation and action for the EKG technician? Option A. Conclude that the ST segment depression is likely due to the patient's peripheral artery disease and requires no further immediate action beyond routine documentation. Option B. Interpret the ST segment depression as indicative of an acute myocardial infarction and immediately initiate emergency protocols without physician confirmation. Option C. Document the ST segment depression in the specified leads and report these findings, along with the patient's history of peripheral artery disease, to the supervising physician for further evaluation. Option D. Attribute the ST segment depression to artifact or non-cardiac causes, as the patient is currently asymptomatic, and proceed with standard EKG reporting. The correct answer is C. Document the ST segment depression in the specified leads and report these findings, along with the patient's history of peripheral artery disease, to the supervising physician for further evaluation. Explanation. Scenario analysis. This scenario presents a challenge in interpreting EKG findings in the context of a patient's known vascular condition. The EKG technician must recognize that certain cardiac changes can be secondary to or indicative of underlying circulatory issues, requiring careful observation and accurate reporting. The professional challenge lies in distinguishing between primary cardiac events and those that are manifestations of compromised blood flow or vascular disease, ensuring the EKG data is contextualized appropriately for the physician. Correct approach analysis. The correct approach involves recognizing that ST segment depression in specific leads, particularly when coupled with a history of peripheral artery disease, can suggest myocardial ischemia. This ischemia may be a consequence of reduced blood flow to the myocardium due to systemic atherosclerosis, which is often associated with peripheral artery disease. Best professional practice dictates that the EKG technician accurately document all findings, including the presence and morphology of ST segment depression, and report this to the supervising physician. This allows for a comprehensive assessment of the patient's cardiovascular status, considering both the direct EKG findings and the implications of their known vascular disease. This aligns with the ethical responsibility to provide accurate and relevant data to facilitate appropriate medical diagnosis and treatment, as guided by general healthcare principles and the specific scope of practice for EKG technicians. Incorrect approaches analysis. One incorrect approach would be to dismiss the ST segment depression as insignificant simply because the patient is asymptomatic at the moment of the EKG. This fails to acknowledge that EKG changes can precede overt symptoms, and that underlying vascular disease significantly increases the risk of cardiac events. Ethically, this constitutes a failure to exercise due diligence and potentially delays critical diagnosis. Another incorrect approach would be to attribute the ST segment depression solely to a non-cardiac cause without sufficient evidence or physician consultation. While other factors can influence EKG readings, ignoring a potential indicator of myocardial ischemia in a patient with known vascular disease is a significant professional oversight. This could violate the principle of providing complete and accurate patient information, A third incorrect approach would be to interpret the EKG findings as definitive evidence of a specific cardiac event, such as an acute myocardial infarction, without the physician's diagnosis. EKG technicians are responsible for obtaining and reporting data, not for making definitive medical diagnoses. Overstepping this boundary is a regulatory and ethical failure. Professional reasoning. Professionals should approach such situations by first meticulously reviewing the EKG tracing for any abnormalities, noting their location, duration, and morphology. Concurrently, they must consider the patient's medical history, particularly any pre-existing conditions that could influence cardiac function or EKG interpretation, such as vascular disease. The next step is to accurately document all findings and immediately report them to the supervising physician, providing the contextual information of the patient's history. This systematic process ensures that all relevant data is considered and communicated, enabling the physician to make an informed diagnosis and treatment plan. Question 3. Performance analysis shows that EKG technicians often encounter subtle variations in cardiac electrical activity. When presented with an EKG tracing that exhibits a regular rhythm but a prolonged PR interval, what is the most appropriate approach for a certified EKG technician to take in their initial assessment? Option A. Assess the duration and morphology of the P-wave and QRS complex and evaluate the relationship between them, noting the consistent prolongation of the PR interval. Option B. Ignore the PR interval and focus on the morphology of the T-wave, as it provides the most critical information about myocardial repolarization. Option C. Concentrate solely on the duration of the QRS complex, looking for any widening that might indicate ventricular conduction issues. Option D. Primarily focus on the heart rate, ensuring it falls within the expected normal range for a resting adult. The correct answer is A. Assess the duration and morphology of the P-wave and QRS complex and evaluate the relationship between them, noting the consistent prolongation of the PR interval. Explanation. Scenario analysis. This scenario presents a common challenge for EKG technicians, interpreting subtle variations in the cardiac cycle and conduction system that may indicate underlying pathology. Differentiating between normal physiological variations and early signs of dysfunction requires a thorough understanding of electrophysiology and the ability to correlate EKG findings with the patient's clinical presentation. The professional challenge lies in accurately identifying the significance of these findings to ensure appropriate patient care and timely intervention, avoiding both underdiagnosis and overdiagnosis. Correct approach analysis. The correct approach involves a systematic evaluation of the EKG tracing, focusing on the timing and morphology of the P-wave, QRS complex, and T-wave, and their relationship to each other. This includes assessing the PR interval, QTC interval, and the presence or absence of any arrhythmias or conduction blocks. Understanding how electrical impulses originate in the SA node, travel through the AV node, bundle of His, bundle branches, and Purkinje fibers is crucial for interpreting these waveforms. Best professional practice, as guided by EKG technician certification standards, e.g., CET, mandates a comprehensive analysis that considers the entire cardiac cycle to identify deviations from normal electrical activity. This aligns with the ethical responsibility to provide accurate and reliable diagnostic information to the interpreting physician. Incorrect approaches analysis. Focusing solely on the heart rate without considering the rhythm or the morphology of individual waveforms is a significant regulatory and ethical failure. This superficial analysis can lead to misdiagnoses of potentially serious arrhythmias or conduction abnormalities. Ignoring the relationship between the P-wave and the QRS complex, or failing to assess the PR interval, bypasses critical diagnostic information about atrial and ventricular depolarization and AV nodal conduction, violating the standard of care expected of a certified EKG technician. Similarly, concentrating only on the QRS duration without evaluating the preceding P-wave and the PR interval neglects the assessment of atrial activity and AV conduction, which is essential for a complete interpretation and can lead to misinterpretation of conduction abnormalities. Professional reasoning. Professionals should approach EKG interpretation by first ensuring the tracing is artifact-free, and then systematically analyzing each component of the cardiac cycle. This involves assessing rate, rhythm, P-wave characteristics, PR interval, QRS duration and morphology, ST segment, T wave, and QTC interval. Correlation with the patient's clinical history and symptoms is paramount. When in doubt, consulting with a qualified supervisor or interpreting physician is an essential part of the decision-making process, ensuring patient safety and adherence to regulatory guidelines for diagnostic accuracy. Question 4. Benchmark analysis indicates that EKG technicians frequently encounter challenges in achieving optimal lead placement due to patient factors. Considering the regulatory framework and guidelines for a certified EKG technician, CET in the United States, which of the following approaches to lead placement is most likely to result in a diagnostic quality EKG while adhering to professional standards? Option A. Ensuring limb leads are placed on the extremities, as distal as possible, and precordial leads are precisely positioned on the correct intercostal spaces and anatomical reference lines. Option B. Securing limb leads to the upper arms and thighs, and placing precordial leads without strict adherence to intercostal spaces to avoid patient discomfort. Option C. Attaching limb leads to the upper torso and precordial leads to the sternal border and clavicular areas. Option D. Placing limb leads on the lower abdomen and precordial leads on any convenient location on the chest. The correct answer is C. Attaching limb leads to the upper torso and precordial leads to the sternal border and clavicular areas. Explanation. Scenario analysis. This scenario presents a common implementation challenge in EKG technician practice, ensuring accurate lead placement under varying patient conditions. The challenge lies in the technician's responsibility to obtain a diagnostic quality tracing while maintaining patient comfort and adhering to established protocols. Factors such as patient anatomy, movement, and the need for clear visualization of specific cardiac segments can complicate standard placement. The technician must exercise critical judgment to adapt techniques without compromising the integrity of the EKG. Correct approach analysis. The correct approach involves meticulous attention to anatomical landmarks and the specific purpose of each lead. For limb leads, ensuring they are placed on the extremities, as distal as possible without interfering with patient mobility or comfort, is crucial for capturing the electrical activity of the heart from different planes. For precordial leads, precise placement on the intercostal spaces and anatomical reference points, e.g., sternal border, midclavicular line, is paramount for accurate representation of the anterior, septal, and lateral views of the heart. This adherence to standardized placement protocols, as outlined by the CET, Certified EKG Technician, guidelines and relevant U.S. regulatory frameworks, e.g., HIPAA for patient privacy during the procedure, OSHA for workplace safety, ensures the diagnostic validity of the EKG and patient safety. The goal is to minimize artifacts and maximize signal clarity, which directly impacts the physician's ability to diagnose cardiac conditions accurately. Incorrect approaches analysis. Placing limb leads on the torso instead of the extremities is a significant regulatory and ethical failure. This violates established EKG protocols, leading to distorted electrical signals and potentially misinterpreting cardiac activity. It compromises the diagnostic accuracy of the EKG, which is a direct failure of professional duty and could lead to incorrect medical management. Furthermore, it demonstrates a lack of understanding of basic EKG principles, which is a failure to meet the competency standards expected of a CET. Attaching precordial leads to bony prominences or areas with significant adipose tissue without proper preparation, e.g., cleaning the skin, can lead to poor electrical connectivity and artifact. This is a failure to follow best practices for lead adhesion and signal acquisition, potentially resulting in a non-diagnostic tracing. Ethically, it represents a lapse in diligence and a failure to provide the highest quality of care. Using incorrect intercostal spaces or reference lines for precordial leads, such as placing V4 too high or V6 too anteriorly, directly impacts the view of specific cardiac regions. This leads to inaccurate representation of the electrical activity in those areas, potentially masking or mimicking pathological findings. This is a failure to adhere to the standardized placement required for accurate interpretation, thus failing to meet the professional standard of care and potentially jeopardizing patient diagnosis and treatment. Professional reasoning. Professionals should approach EKG lead placement with a systematic process. First, they must review the patient's chart for any specific conditions or previous EKG findings that might influence placement. Second, they should identify and clearly visualize the correct anatomical landmarks for each lead. Third, they should communicate with the patient, explaining the procedure and ensuring their comfort and cooperation. Fourth, they must apply the leads with precision, checking for good adhesion and minimal artifact. Finally, they should review the EKG tracing for quality and completeness before submitting it for interpretation. This decision-making process prioritizes accuracy, patient safety, and adherence to professional standards, ensuring that the obtained EKG is both diagnostic and ethically sound. Question 5. Analysis of an EKG tracing reveals a QRS complex that is wider than the normal duration and exhibits a notched appearance. As a certified EKG technician, CET, what is the most appropriate action to take regarding these QRS complex characteristics? Option A. Focus on calculating the heart rate and rhythm only, as QRS complex characteristics are beyond the scope of a CET's responsibilities. Option B. Document the observed QRS complex duration and morphology accurately in the patient's record and immediately report these findings to the supervising physician or qualified healthcare provider for further evaluation. Option C. Ignore the widened and notched QRS complex as it is a common finding in many patients and does not require immediate attention. Option D. Conclude that the patient is experiencing a bundle branch block and inform the patient of the diagnosis. The correct answer is B. Document the observed QRS complex duration and morphology accurately in the patient's record and immediately report these findings to the supervising physician or qualified healthcare provider for further evaluation. Explanation. The scenario presents a common challenge for EKG technicians, interpreting subtle variations in the QRS complex and understanding their clinical implications within the scope of their practice. The professional challenge lies in accurately identifying deviations from normal morphology and understanding when these deviations warrant immediate attention or further investigation by a qualified healthcare provider, adhering strictly to the established scope of practice for a certified EKG technician, CET. The correct approach represents best professional practice because it aligns with the CET's role as defined by regulatory frameworks and professional guidelines. A CET is trained to recognize and document EKG findings, including abnormalities in the QRS complex, and to communicate these findings to the supervising physician or qualified healthcare professional. This approach prioritizes patient safety by ensuring that potentially significant findings are not overlooked and are escalated appropriately, thereby upholding the ethical obligation to provide competent and safe patient care as mandated by CET certification standards. An incorrect approach that focuses solely on diagnosing the underlying cardiac condition would represent a significant regulatory and ethical failure. The CET scope of practice does not include medical diagnosis. Attempting to diagnose a condition based on EKG findings exceeds the technician's training and certification, potentially leading to misdiagnosis, delayed or incorrect treatment, and patient harm. This violates the principle of practicing within one's scope of competence and could be considered a breach of professional conduct, potentially leading to disciplinary action by the certifying body. Another incorrect approach, such as ignoring or downplaying a QRS complex abnormality because it appears minor, is also professionally unacceptable. Even subtle changes can be indicative of underlying pathology or a progression of a known condition. Failing to document or report such findings constitutes negligence and a failure to adhere to the standard of care expected of a CET. This directly contravenes the ethical imperative to act in the patient's best interest and to maintain accurate and complete patient records. The professional decision-making process for similar situations should involve a systematic evaluation of the EKG tracing. This includes assessing the duration, amplitude, and morphology of the QRS complex. The technician must compare findings to established normal parameters and recognize common patterns of abnormality. Crucially, the decision-making process must include a clear understanding of when to escalate findings based on established protocols and the supervising physician's orders. This involves recognizing that the primary responsibility is accurate data acquisition and preliminary interpretation, followed by timely and appropriate communication of findings to the appropriate medical personnel for definitive diagnosis and management. Question 6. The efficiency study reveals that a significant portion of patient wait times in the cardiology department is attributed to the time taken for electrocardiogram (EKG) procedures. Considering the primary role of an EKG technician, which of the following best describes the fundamental definition and purpose of an EKG in the context of improving procedural efficiency? Option A. An EKG is a diagnostic tool that records the heart's electrical activity, providing a graphical representation of its rhythm and rate, which is essential for identifying potential cardiac abnormalities and guiding clinical decisions. Option B. An EKG is a therapeutic device used to deliver electrical impulses to correct irregular heartbeats during an emergency. Option C. An EKG is a quick screening tool used to assess a patient's overall physical fitness before any strenuous activity. Option D. An EKG is a method for measuring blood pressure and oxygen saturation levels in the heart. Correct answer is A. An EKG is a diagnostic tool that records the heart's electrical activity, providing a graphical representation of its rhythm and rate, which is essential for identifying potential cardiac abnormalities and guiding clinical decisions. Explanation: the efficiency study reveals that a significant portion of patient wait times in the cardiology department is attributed to the time taken for electrocardiogram (EKG) procedures. This scenario is professionally challenging because it directly impacts patient care flow and departmental resource allocation. As an EKG technician, understanding the fundamental definition and purpose of an EKG is crucial for optimizing the procedure's efficiency without compromising diagnostic accuracy or patient safety. The core purpose of an EKG is to record the electrical activity of the heart, providing vital diagnostic information. Efficiently performing this task requires a clear understanding of what constitutes an EKG and its diagnostic utility, enabling the technician to anticipate needs and streamline the process. The correct approach represents best professional practice because it aligns with the fundamental principles of EKG diagnostics and patient care. A thorough understanding of the EKG's definition and purpose allows the technician to accurately identify the diagnostic information being sought, ensuring proper lead placement, artifact reduction, and a clear tracing. This directly contributes to the efficiency study's goal by minimizing the need for repeat procedures due to technical errors or incomplete data. Adhering to established protocols and understanding the clinical significance of the recorded electrical activity ensures that the EKG serves its intended diagnostic purpose effectively, thereby reducing unnecessary delays. An incorrect approach that focuses solely on speed without regard for diagnostic quality would be a regulatory and ethical failure. This could lead to inaccurate readings, requiring repeat EKGs and ultimately increasing, not decreasing, wait times. It also violates the ethical obligation to provide accurate and reliable diagnostic information to the physician. Another incorrect approach that misinterprets the purpose of an EKG, perhaps by focusing on non-diagnostic aspects or attempting to interpret the results themselves, will be a failure to adhere to the scope of practice for an EKG technician. This not only compromises the efficiency of the procedure, but also poses a risk to patient safety by potentially leading to miscommunication or misinterpretation of findings. Furthermore, any approach that deviates from established protocols without a clear understanding of the underlying diagnostic principles would be a failure to meet professional standards and regulatory guidelines for EKG performance. Professionals should employ a decision-making framework that prioritizes understanding the why behind each step of the EKG procedure. This involves recognizing that the EKG is a diagnostic tool, and its purpose is to capture specific electrical signals that reflect cardiac function. When faced with efficiency challenges, the technician should first ensure their foundational knowledge of the EKG's definition and purpose is robust. This understanding then guides decisions on lead placement, patient preparation, and artifact management, all of which directly impact the quality and speed of the diagnostic recording. The goal is to achieve a high-quality diagnostic tracing on the first attempt, thereby maximizing efficiency and contributing to better patient flow. Question 7. Market research demonstrates that patients experiencing intermittent symptoms of palpitations and suspected arrhythmias often require extended monitoring to capture these transient events. Given this, which type of electrocardiogram is most appropriate for a patient whose symptoms are not consistently present during a standard in-office assessment? Option A. A single-lead portable electrocardiogram. Option B. A Holter monitor. Option C, a standard 12-lead electrocardiogram. Option D, an electrophysiology study. The correct answer is B, a Holter monitor. Explanation: scenario analysis. This scenario presents a professional challenge due to the need to select the most appropriate electrocardiogram (EKG) modality for a patient-specific clinical presentation and the potential impact on diagnostic accuracy and patient care. The challenge lies in understanding the distinct applications and limitations of different ECG types, ensuring that the chosen method aligns with the physician's diagnostic goals and the patient's condition, while also adhering to established clinical protocols and the scope of practice for an EKG technician. Misjudgment can lead to delayed or incorrect diagnoses, unnecessary patient discomfort, and inefficient use of resources. Correct approach analysis. The correct approach involves a thorough understanding of the clinical indication provided by the referring physician and matching it to the diagnostic capabilities of various ECG types. For patient experiencing intermittent palpitations and suspected arrhythmias that are not present during a standard in-office ECG, a Holter monitor is the most appropriate choice. This is because a Holter monitor provides continuous ECG recording over an extended period, typically 24-48 hours or longer, significantly increasing the likelihood of capturing transient arrhythmic events. This aligns with best professional practice by ensuring that diagnostic efforts are targeted and effective, leading to a more accurate diagnosis and timely treatment. Regulatory guidelines for EKG technicians emphasize performing procedures as ordered and understanding the purpose of each test to ensure patient safety and diagnostic integrity. Incorrect approaches analysis. One incorrect approach would be to perform a standard 12-lead ECG without considering the intermittent nature of the symptoms. While a 12-lead ECG is crucial for evaluating acute cardiac events or baseline electrical activity, it is unlikely to capture symptoms that occur sporadically. This approach fails to meet the diagnostic needs of the patient and the referring physician, potentially leading to a false negative result and a delay in diagnosis. Ethically, this represents a failure to provide appropriate care. Another incorrect approach would be to immediately proceed with a more complex or invasive test without a clear indication. For instance, suggesting an electrophysiology study, EPS, without first attempting less invasive diagnostic methods like a Holter monitor would be inappropriate. This could lead to unnecessary patient risk, cost, and anxiety. It also demonstrates a lack of understanding of the diagnostic pathway and the tiered approach to cardiac investigations. A further incorrect approach would be to unilaterally decide to perform a different type of ECG, such as an event monitor, without consulting the referring physician or understanding the specific diagnostic question. While an event monitor is also a long-term monitoring device, its activation is typically patient-initiated, which might not be ideal for capturing all types of intermittent symptoms, especially if the patient is unaware of the exact timing of their palpitations. This bypasses the physician's order and demonstrates a lack of adherence to established protocols. Professional reasoning. Professionals should employ a systematic decision-making process that begins with carefully reviewing the physician's order and understanding the patient's chief complaint and history. This involves considering the temporal characteristics of the symptoms, e.g., continuous, intermittent, exertional. Next, the technician should assess the diagnostic capabilities of available ECG modalities and their suitability for the specific clinical scenario. If there is any ambiguity, or if the order seems incomplete given the patient's presentation, the technician should seek clarification from the referring physician. Adherence to institutional policies and scope of practice guidelines is paramount. This structured approach ensures that the most appropriate diagnostic test is selected, maximizing diagnostic yield, ensuring patient safety, and upholding professional standards. Question 8. Research into the proper application of augmented limb leads for a patient undergoing a standard 12-lead EKG reveals a potential for confusion regarding their precise placement. Which of the following actions by the EKG technician best demonstrates adherence to best practices for ensuring accurate augmented limb lead data? Option A. Confirming the correct anatomical landmarks for each augmented limb lead, a VR, a VL, a VF, and meticulously placing the electrodes at these precise locations. Option B. Assuming that any placement on the respective limb will yield acceptable data for diagnostic interpretation. Option C. prioritizing speed of lead application over precise anatomical placement to expedite the EKG procedure. Option D. Applying the augmented limb leads based on a general understanding of limb positioning, without strict adherence to specific anatomical landmarks. Correct answer is D. Applying the augmented limb leads based on a general understanding of limb positioning, without strict adherence to specific anatomical landmarks. Explanation. This scenario presents a professional challenge because the EKG technician is responsible for accurate lead placement, which directly impacts the diagnostic quality of the electrocardiogram. Misinterpreting or misplacing augmented limb leads can lead to incorrect diagnosis, potentially causing patient harm due to inappropriate treatment or delayed necessary interventions. The technician must possess a thorough understanding of lead placement principles and the anatomical landmarks associated with each lead to ensure optimal signal acquisition. The correct approach represents best professional practice because it adheres to established EKG technician protocols and guidelines, which are implicitly or explicitly mandated by regulatory bodies overseeing healthcare practice and patient safety. Accurate placement of a VR, a VL, and a VF ensures that the electrical activity of the heart is viewed from specific perspectives, crucial for identifying abnormalities in different cardiac regions. This meticulous attention to detail aligns with the ethical obligation to provide competent and safe patient care, minimizing the risk of diagnostic error. An incorrect approach involving the assumption that lead placement is interchangeable or can be approximated without precise anatomical reference is a significant regulatory and ethical failure. This demonstrates a lack of fundamental knowledge and skill, violating the standard of care expected of a certified EKG technician. Such negligence could be considered a breach of professional duty, potentially leading to disciplinary action by certifying bodies and exposing the healthcare facility to liability. Furthermore, it undermines patient trust and the integrity of the diagnostic process. The professional decision-making process for similar situations involves a systematic approach. First, confirm understanding of the specific lead being applied and its intended anatomical placement. Second, meticulously identify the correct anatomical landmarks for that lead. Third, carefully position the electrode according to these landmarks, ensuring good skin contact and minimizing artifact. Finally, review the generated EKG tracing for any obvious artifacts or abnormalities that might suggest lead misplacement. And if in doubt, consult with a qualified supervisor or physician. This iterative process of verification and validation is key to ensuring accuracy and patient safety. Question 9. System analysis indicates that an EKG technician is performing a routine electrocardiogram on a patient. The patient, showing a keen interest in the technology, asks, "How did this machine even come about? What's the story behind how we started measuring heart electricity?" Considering the EKG technician, CET exams focus on the history of electrocardiography. Which of the following responses best reflects a professional and informative approach to the patient's inquiry? Option A. Provide a detailed, technical lecture on the electrophysiology of the heart and the specific engineering challenges faced by early researchers in developing the first electrocardiographs, using complex terminology. Option B. Tell the patient that the history of the EKG is complex and not relevant to their current procedure, and that they should focus on remaining still for accurate readings. Option C. State that the EKG machine was invented by a single brilliant scientist in the early 20th century, and that its development was a straightforward process. Option D. Briefly explain that the EKG machine is a result of scientific discoveries over time, starting with early observations of the heart's electrical activity by scientists like Willem Einthoven, and how these discoveries led to the development of the diagnostic tool used today to assess heart function. The correct answer is D. Briefly explain that the EKG machine is a result of scientific discoveries over time, starting with early observations of the heart's electrical activity by scientists like Willem Einthoven, and how these discoveries led to the development of the diagnostic tool used today to assess heart function. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an EKG technician to understand the historical context of their practice to effectively communicate with a patient and address their concerns. The challenge lies in translating complex historical developments into understandable information for a layperson, while also ensuring the information provided is accurate and relevant to the patient's current experience. The technician must balance providing educational context with maintaining patient comfort and trust, avoiding overwhelming or confusing the patient. Correct approach analysis. The correct approach demonstrates best professional practice by acknowledging the patient's curiosity and framing the history of electrocardiography in a way that highlights its evolution and impact on patient care. This approach is ethically sound, as it respects the patient's right to information and promotes a collaborative patient-provider relationship. It aligns with the principle of patient education, a key component of quality healthcare delivery, and implicitly supports the technician's role in understanding the foundational principles of their diagnostic tools. While specific regulations for EKG technicians in the U.S. regarding patient education on historical context may not be explicitly detailed, the overarching ethical guidelines for healthcare professionals emphasize clear communication and patient empowerment. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's question as irrelevant to their immediate EKG procedure. This fails to acknowledge the patient's engagement and can create a barrier to communication, potentially leading to patient dissatisfaction and a lack of trust. Ethically, it disregards the patient's autonomy and their desire to understand their healthcare. Another incorrect approach would be to provide an overly technical and detailed historical lecture that is beyond the patient's comprehension. This, while perhaps factually accurate, would be professionally ineffective, as it would likely confuse and overwhelm the patient, defeating the purpose of providing information. It demonstrates a lack of understanding of effective patient communication and empathy. A third incorrect approach would be to invent or speculate about historical details. This is a direct violation of professional integrity and accuracy. Providing misinformation, even with good intentions, erodes trust and can have negative consequences if the patient acts upon it. This is ethically unacceptable and undermines the credibility of the healthcare provider and the institution. Professional reasoning. Professionals should approach patient inquiries with an open mind and a commitment to clear, accurate, and empathetic communication. When faced with a question about the history of a procedure, the decision-making process involves 1. Assessing the patient's apparent level of understanding and interest. 2. Determining the most relevant and accessible historical context that can enhance their understanding of the current procedure. 3. Communicating this information concisely and in layman's terms. 4. Being prepared to answer follow-up questions or direct the patient to appropriate resources if further information is desired. This process prioritizes patient well-being, trust, and effective communication within the scope of the technician's role. Question 10. Compliance review shows an EKG technician is tasked with interpreting a patient's cardiac rhythm. The technician must accurately assess the electrical conduction pathway to determine the origin and sequence of depolarization and repolarization. Which of the following best describes the technician's understanding of the electrical conduction pathway as demonstrated by their interpretation of a standard EKG tracing? Option A. The technician notes the presence of a QRS complex and its duration, but does not assess the relationship of the P wave to the QRS complex or the PR interval. Option B. The technician correctly identifies the P wave as representing atrial depolarization, the PR interval as the time for the impulse to travel from the SA node through the AV node to the ventricles, the QRS complex as ventricular depolarization, and the T wave as ventricular repolarization, demonstrating a comprehensive understanding of the electrical conduction sequence. Option C. The technician focuses primarily on the regularity of the RR intervals, assuming a normal rhythm without evaluating the presence and morphology of the P waves or the duration of the PR intervals. Option D. The technician identifies waveform abnormalities on the EKG, but fails to correlate these findings with the specific electrical conduction abnormalities that cause them. The correct answer is B. The technician correctly identifies the P wave as representing atrial depolarization, the PR interval as the time for the impulse to travel from the SA node through the AV node to the ventricles, the QRS complex as ventricular depolarization, and the T wave as ventricular repolarization, demonstrating a comprehensive understanding of the electrical conduction sequence. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the EKG technician to interpret a patient's cardiac rhythm in the context of their underlying electrical conduction system. Misinterpreting the electrical activity can lead to incorrect diagnoses, inappropriate interventions, and potentially adverse patient outcomes. The technician must demonstrate a thorough understanding of the normal electrical pathway and how deviations from this pathway manifest on an EKG. Correct approach analysis. The correct approach involves accurately identifying the P wave, PR interval, QRS complex, and T wave, and understanding their relationship to the electrical impulse originating in the SA node, traveling through the AV node, bundle of His, bundle branches, and Purkinje fibers. This understanding allows the technician to recognize normal sinus rhythm and differentiate it from various arrhythmias that arise from abnormalities in the conduction pathway. Adherence to established EKG interpretation protocols and understanding the physiological basis of each waveform is paramount for accurate reporting, which is a core competency expected of a certified EKG technician. Incorrect approach is analysis. One incorrect approach would be to focus solely on the presence of a QRS complex without considering the preceding P wave and the PR interval. This fails to assess the integrity of the conduction from the atria to the ventricles, potentially missing issues like heart block or atrial abnormalities. This is a regulatory failure, as it bypasses a critical step in systematic EKG interpretation, leading to incomplete and potentially erroneous data. Another incorrect approach would be to assume a normal rhythm based on a regular RR interval alone. While regularity is a component of normal sinus rhythm, it does not guarantee that the impulse is originating from the SA node or conducting properly through the AV node. This approach ignores the atrial activity and the AV conduction, which is a failure to adhere to the comprehensive diagnostic standards for EKG interpretation. A third incorrect approach would be to identify abnormalities in waveforms without correlating them to the patient's electrical conduction pathway. For example, recognizing a wide QRS complex without considering if it represents a ventricular origin or a bundle branch block demonstrates a superficial understanding and a failure to apply the foundational knowledge of cardiac electrophysiology, which is a direct violation of the expected competency standards for an EKG technician. Professional reasoning. Professionals should approach EKG interpretation systematically, starting with the SA node and tracing the electrical impulse through the entire conduction pathway. This involves evaluating the P wave atrial depolarization, PR interval AV conduction time, QRS complex ventricular depolarization, and ST segment/T wave ventricular repolarization. By understanding how each component reflects a specific part of the electrical conduction, technicians can accurately identify normal rhythms and recognize deviations that indicate pathology. This systematic approach ensures comprehensive analysis and accurate reporting, aligning with regulatory expectations for patient care. Question 11. Which approach would be most appropriate for an EKG technician to accurately analyze a complex cardiac rhythm strip, ensuring patient safety and adherence to professional standards? Option A. Analyzing only the heart rate and the duration of the QRS complex, as these are the most critical components. Option B. A systematic step-by-step evaluation of the EKG tracing, including rate, rhythm regularity, P waves, PR interval, and QRS complex. Option C. Focusing exclusively on the patient's reported symptoms to guide the rhythm interpretation. Option D. Relying primarily on visual pattern recognition of the rhythm strip, comparing it to known common arrhythmias. The correct answer is B. A systematic step-by-step evaluation of the EKG tracing, including rate, rhythm regularity, P waves, PR interval, and QRS complex. Explanation. Scenario analysis. The scenario presents a common yet critical challenge for an EKG technician, interpreting a complex rhythm strip that deviates from typical patterns. The professional challenge lies in accurately identifying the underlying rhythm to ensure appropriate patient care and timely intervention. Misinterpretation can lead to delayed or incorrect treatment, potentially harming the patient. The technician must rely on a systematic approach to rhythm analysis, integrating knowledge of electrophysiology with established diagnostic criteria. Correct approach analysis. The correct approach involves a systematic, step-by-step analysis of the EKG tracing, beginning with the most fundamental components. This typically includes assessing the heart rate, evaluating the regularity of the rhythm, identifying the presence and morphology of P waves, determining the PR interval, and examining the QRS complex duration and morphology. This methodical process ensures that all critical elements of the EKG are considered, minimizing the chance of overlooking subtle but significant abnormalities. Adherence to this systematic approach aligns with the core competencies and best practices expected of a certified EKG technician, as outlined by professional standards and guidelines that emphasize accuracy and patient safety. This structured method is crucial for consistent and reliable interpretation, forming the bedrock of effective rhythm analysis. Incorrect approaches analysis. One incorrect approach is to rely solely on pattern recognition without a systematic evaluation. This can lead to misdiagnosis, especially with atypical presentations or when multiple abnormalities are present. For instance, a technician might quickly label a rhythm based on a superficial resemblance to a common arrhythmia, failing to notice subtle deviations in P-wave morphology or PR interval that indicate a different underlying cause. This bypasses the critical diagnostic steps and can result in a failure to meet the standard of care, potentially violating ethical obligations to provide accurate assessments. Another incorrect approach is to focus on only one or two EKG components while neglecting others. For example, solely measuring the heart rate without examining the P-waves and QRS complexes would be insufficient for accurate rhythm diagnosis. This incomplete analysis fails to capture the full picture of cardiac electrical activity and can lead to significant diagnostic errors. Such an approach would not meet the professional expectations for a thorough EKG interpretation and could be considered negligent if it leads to adverse patient outcomes. A third incorrect approach is to make a diagnosis based on patient symptoms alone without a thorough EKG analysis. While symptoms are important indicators, they must be correlated with objective EKG findings. Relying solely on symptoms without a proper rhythm analysis would be a failure to perform the core duty of an EKG technician, which is to accurately interpret the electrical activity of the heart. This could lead to a misdiagnosis and inappropriate management, directly impacting patient safety and potentially violating professional standards. Professional reasoning. Professionals should employ a decision-making framework that prioritizes systematic analysis. This involves 1. Initial assessment of rate and rhythm regularity. 2. Detailed examination of P-waves, presence, morphology, relationship to QRS. 3. Measurement of the PR interval. 4. Evaluation of the QRS complex duration, morphology. 5. Assessment of the ST segment and T-wave for ischemic changes. This structured approach ensures all diagnostic criteria are met, leading to accurate and reliable rhythm interpretation, which is paramount for patient care and aligns with professional ethical obligations. Question 12. The review process indicates that an EKG technician is monitoring a patient's cardiac rhythm and observes a new onset of significant bradycardia with occasional premature ventricular contractions. The technician also notes a slight decrease in the patient's peripheral pulse strength. Considering the potential impact on cardiac output and patient hemodynamics, what is the most appropriate immediate action for the EKG technician to take? Option A. Immediately alert the supervising physician or appropriate clinical staff to the observed EKG changes and potential hemodynamic compromise. Option B. Ignore the findings, assuming they are transient and not indicative of a significant issue. Option C. Document the EKG findings and the observed pulse quality change in the patient's chart and continue monitoring. Option D. Advise the patient to take slow, deep breaths to improve their heart rate and circulation. The correct answer is C. Document the EKG findings and the observed pulse quality change in the patient's chart and continue monitoring. Explanation. Scenario analysis. This scenario presents a challenge because it requires the EKG technician to interpret hemodynamic data beyond basic rhythm identification, specifically relating it to cardiac output. The technician must understand the physiological implications of observed EKG changes on the heart's pumping efficiency, even without direct measurement of cardiac output. This necessitates a risk assessment approach to identify potential issues that could impact patient stability. Correct approach analysis. The correct approach involves recognizing that certain EKG findings, such as significant bradycardia or new-onset arrhythmias, can directly and negatively impact cardiac output by reducing stroke volume and slash or heart rate. A responsible EKG technician, adhering to the CET Certified EKG Technician, scope of practice and relevant U.S. regulatory frameworks, e.g., OSHA for workplace safety, HIPAA for patient privacy, and general principles of patient care as outlined by accrediting bodies, would prioritize patient safety by alerting the appropriate clinical personnel. This proactive communication ensures that a physician or other qualified healthcare provider can assess the patient's hemodynamic status and intervene if necessary, thereby preventing potential adverse events. This aligns with the ethical duty of care and the principle of non-maleficence. Incorrect approaches analysis. One incorrect approach is to simply document the EKG findings without considering their potential hemodynamic implications. This fails to meet the standard of care expected of a CET, as it ignores the functional significance of the electrical activity. Ethically, this could be considered negligence by omission, as the technician did not act on information that could reasonably predict patient compromise. Regulatory frameworks emphasize the importance of reporting critical findings that impact patient well-being. Another incorrect approach is to attempt to diagnose the cause of the hemodynamic compromise or prescribe treatment. This exceeds the scope of practice for an EKG technician. U.S. regulations and professional guidelines strictly define the roles and responsibilities of allied health professionals. Attempting to diagnose or treat is a violation of these boundaries and could lead to patient harm and professional disciplinary action. A third incorrect approach is to ignore the EKG findings altogether, assuming they are not clinically significant. This is a direct failure to perform the core duties of an EKG technician and a breach of the duty of care. It demonstrates a lack of understanding of the relationship between EKG abnormalities and cardiovascular function, which is fundamental to the CET certification. This could lead to delayed or missed critical interventions, directly endangering the patient. Professional reasoning. Professionals should employ a systematic approach. First, accurately acquire and interpret the EKG tracing according to established protocols. Second, critically assess the findings for any deviations from normal or previously recorded baselines, paying close attention to rate, rhythm, and morphology. Third, consider the potential physiological consequences of these findings, particularly concerning hemodynamic stability. Fourth, if there is a concern for compromised cardiac output or patient instability, immediately communicate these findings and concerns to the supervising physician or appropriate clinical team member, following facility protocols. This decision-making process prioritizes patient safety and adheres to professional scope of practice and ethical obligations. Question 13. The analysis reveals an EKG tracing with a heart rate of 72 beats per minute, a regular rhythm and clear P waves preceding each QRS complex. However, upon closer inspection, the PR interval appears to be consistently prolonged at 0.24 seconds, and the QRS duration is within normal limits. What is the most appropriate professional action for the EKG technician? Option A. Attempt to reposition the EKG leads to see if the prolonged PR interval resolves, assuming it is an artifact. Option B. Consider the prolonged PR interval to be within acceptable variation and proceed with routine documentation. Option C. Immediately inform the physician that the patient is experiencing a serious cardiac event based on the prolonged PR interval. Option D. Document the prolonged PR interval as a significant finding and report it to the interpreting physician. Correct answer is D. Document the prolonged PR interval as a significant finding and report it to the interpreting physician. Explanation. This scenario presents a professional challenge due to the potential for misinterpretation of EKG waveforms, which can lead to delayed or incorrect patient care. The EKG technician's role is critical in accurately identifying normal and abnormal findings to facilitate timely medical intervention. Adherence to established protocols and a thorough understanding of EKG interpretation are paramount to patient safety and effective healthcare delivery. The correct approach involves recognizing the subtle but significant deviation from a normal sinus rhythm and understanding its potential implications. This demonstrates a commitment to accurate data collection and reporting, which is a core ethical and professional responsibility for EKG technicians. By identifying and documenting the abnormality, the technician ensures that the interpreting physician has the most complete and accurate information for diagnosis and treatment planning, aligning with the principle of beneficence and non-maleficence in patient care. This also upholds the professional standards expected of a certified EKG technician, ensuring they are contributing effectively to the healthcare team. An incorrect approach of dismissing the finding as insignificant or within normal variation would be a significant professional and ethical failure. This could lead to a misdiagnosis of a potentially serious cardiac condition, directly violating the principle of non-maleficence. It also represents a failure to adhere to professional competency standards, as the technician is not accurately performing their duties. Furthermore, it could be seen as a breach of professional integrity, as it implies a lack of diligence and commitment to patient well-being. Another incorrect approach of immediately alarming the physician without proper initial assessment and documentation would also be professionally problematic. While prompt reporting is important, a technician's role includes initial interpretation and documentation. Jumping to conclusions without a systematic review can create unnecessary alarm and potentially disrupt the workflow. It also bypasses the technician's responsibility to provide a clear, documented observation for the physician to review, rather than a panicked verbal report. This could be seen as a failure to exercise professional judgment and follow established reporting procedures. A further incorrect approach of attempting to fix the EKG by repositioning leads without a clear indication or understanding of the cause of the artifact would be a violation of proper procedure. Artifacts should be identified and noted, and if they obscure the tracing, the technician should attempt to resolve them through standard troubleshooting. However, making adjustments without a clear understanding of the waveform abnormality could lead to further misinterpretation or mask a genuine cardiac event. This demonstrates a lack of technical skill and adherence to diagnostic integrity. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and assess. Carefully review the entire EKG tracing for rate, rhythm, P waves, QRS complexes, and T waves. 2. Identify deviations. Note any findings that deviate from expected normal parameters. 3. Consider potential causes based on the observed waveform. Consider possible underlying cardiac conditions or technical artifacts. 4. Document findings. Accurately record all observations, including any identified abnormalities and their characteristics. 5. Report appropriately. Communicate findings to the supervising physician or designated healthcare professional according to established protocols, providing clear and concise documentation. 6. Seek clarification. If unsure about any finding, do not hesitate to seek guidance from a qualified supervisor or physician. Question 14. Strategic planning requires an EKG technician to anticipate how variations in the anatomical structure of the thoracic cavity and the relative position of the heart might influence the accuracy and interpretation of an electrocardiogram. Which of the following actions best reflects a proactive approach to ensuring diagnostic quality in the face of such anatomical considerations? Option A. Systematically applying knowledge of cardiac anatomy to guide precise lead placement, adjusting for patient-specific structural differences to minimize artifact and ensure optimal signal acquisition. Option B. Adjusting lead placement based on subjective visual cues of the patient's chest without a systematic understanding of the underlying anatomical relationships. Option C. Proceeding with standard lead placement regardless of perceived anatomical variation, assuming the EKG machine's algorithms will compensate for any discrepancies. Option D. Immediately flagging any tracing that deviates from a textbook example as potentially pathological, without first considering anatomical influences on lead placement. The correct answer is A. Systematically applying knowledge of cardiac anatomy to guide precise lead placement, adjusting for patient-specific structural differences to minimize artifact and ensure optimal signal acquisition. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an EKG technician to interpret subtle anatomical variations and their potential impact on EKG tracing accuracy, directly affecting diagnostic reliability. Misinterpreting these variations can lead to incorrect diagnoses or missed critical findings, underscoring the need for precise anatomical knowledge and its application in a clinical setting. The technician must balance speed with accuracy, ensuring patient safety and adherence to established protocols. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the technician's foundational knowledge of cardiovascular anatomy and physiology, understanding the precise location and relationship of the heart chambers, valves, and major vessels, allows for accurate lead placement and interpretation of EKG waveforms. This aligns with the CET certification's emphasis on the technical and physiological aspects of EKG acquisition and preliminary analysis, ensuring that the resulting tracing is a true reflection of the patient's cardiac electrical activity, free from artifact caused by anatomical misinterpretation. This upholds the ethical responsibility to provide accurate data for physician diagnosis. Incorrect approaches analysis. One incorrect approach would be to solely rely on a standardized EKG protocol without considering individual anatomical differences. This fails to acknowledge that variations in chest wall thickness, rib cage structure, or the relative position of the heart can significantly alter lead placement and signal transmission, leading to artifact or misrepresentation of the cardiac rhythm. This approach risks generating an inaccurate EKG, violating the principle of providing reliable patient data. Another incorrect approach would be to assume that any deviation from a standard tracing is immediately indicative of pathology without first considering anatomical influences. This bypasses the crucial step of differentiating between physiological variations and true pathological changes, potentially leading to unnecessary alarm or misdiagnosis. It neglects the technician's role in ensuring the quality and interpretability of the EKG tracing before it reaches the physician. A further incorrect approach would be to adjust lead placement arbitrarily based on perceived anatomical differences without a clear understanding of the underlying physiological principles. This can introduce new artifacts or obscure important electrical signals, compromising the diagnostic value of the EKG. It demonstrates a lack of systematic understanding and a departure from evidence-based practice. Professional reasoning. Professionals should approach EKG acquisition by first reviewing the patient's chart for any relevant anatomical considerations or previous EKG findings. They should then perform a systematic assessment of the patient's chest, considering landmarks for lead placement. When anatomical variations are noted, the technician must apply their knowledge of cardiovascular anatomy to anticipate potential impacts on lead placement and signal quality. If artifact is suspected due to anatomical variation, the technician should attempt to correct lead placement based on anatomical understanding and physiological principles, documenting any adjustments made. If persistent artifact or unusual findings occur that cannot be resolved through proper technique, the technician must clearly document these observations for the interpreting physician, ensuring that the limitations of the tracing are understood. Question 15. Risk assessment procedures indicate that a patient presents with an irregular ventricular rhythm on their EKG. To optimize patient care and ensure accurate diagnosis, what is the most critical step in differentiating between atrial fibrillation and atrial flutter? Option A. Carefully examine the atrial activity for the presence of organized sawtooth flutter waves, particularly in the inferior leads, and assess the regularity of the RR intervals in conjunction with this finding. Option B. Conclude that the patient has atrial fibrillation solely based on the irregular ventricular rhythm. Option C. Rely on the patient's reported symptoms of palpitations as the primary diagnostic indicator. Option D. Focus on the duration of the QRS complexes to determine the underlying rhythm. The correct answer is A. Carefully examine the atrial activity for the presence of organized sawtooth flutter waves, particularly in the inferior leads, and assess the regularity of the RR intervals in conjunction with this finding. Explanation. Scenario analysis. This scenario presents a common challenge in EKG interpretation, where subtle waveform characteristics can differentiate between potentially serious atrial arrhythmias. The professional challenge lies in accurately identifying the underlying rhythm to ensure appropriate patient management and prevent adverse outcomes. Misinterpretation can lead to delayed or incorrect treatment, impacting patient safety and adherence to established clinical protocols. Correct approach analysis. The correct approach involves meticulous examination of the P waves and the RR intervals. In atrial flutter, characteristic sawtooth flutter waves are typically visible in the inferior leads, Roman 2, Roman 3, of VF, and are often more regular than the chaotic P waves of atrial fibrillation. The ventricular response in atrial flutter can be regular or irregular, depending on the degree of AV block, but the underlying atrial activity is organized flutter waves. This detailed waveform analysis is crucial for accurate diagnosis, and aligns with the CET's responsibility to perform and interpret EKGs according to established diagnostic criteria and best practices, ensuring patient care is based on precise data. Incorrect approach is analysis, focusing solely on the presence of an irregular ventricular rhythm without examining the atrial activity is a significant regulatory and ethical failure. Atrial fibrillation is characterized by chaotic, irregular P waves and an irregularly irregular RR interval. While an irregular rhythm is present in both conditions, the absence of organized flutter waves and the presence of fibrillatory waves are diagnostic hallmarks of atrial fibrillation. Ignoring these specific atrial characteristics leads to misdiagnosis. Similarly, assuming a diagnosis based on a single lead or a general impression of irregularity, without a systematic review of all leads and waveform morphology, violates the principle of thoroughness and accuracy expected of a certified technician. This can lead to inappropriate treatment decisions, potentially harming the patient and failing to meet the standards of care mandated by regulatory bodies overseeing healthcare professionals. Professional reasoning. Professionals should approach EKG interpretation with a systematic methodology. This includes assessing the overall rhythm regularity, identifying the presence and morphology of P waves, or their absence/abnormality, measuring the PR interval, and evaluating the QRS complex duration and morphology. When faced with potential atrial arrhythmias, a deep dive into the atrial activity P waves or flutter waves and the regularity of the ventricular response is paramount. This structured approach, combined with ongoing education and adherence to established diagnostic guidelines, ensures accurate interpretation and supports optimal patient care, minimizing the risk of diagnostic errors and their associated consequences. Question 16. During the evaluation of a patient's EKG tracing, which of the following best describes the anatomical and electrical sequence that leads to ventricular depolarization? Option A. The electrical impulse originates in the Purkinje fibers, travels through the bundle branches, and then depolarizes the atria and AV node. Option B. The electrical impulse originates in the SA node, travels directly to the ventricles, bypassing the AV node and bundle branches. Option C. The electrical impulse originates in the AV node, travels through the ventricles, and then depolarizes the atria. Option D. The electrical impulse originates in the SA node, travels through the atria, is delayed at the AV node, and then rapidly conducts through the bundle of his right and left bundle branches and Purkinje fibers to depolarize the ventricles. The correct answer is D. The electrical impulse originates in the SA node, travels through the atria, is delayed at the AV node, and then rapidly conducts through the bundle of his right and left bundle branches and Purkinje fibers to depolarize the ventricles. Explanation. This scenario presents a professional challenge because an EKG technician must accurately interpret the electrical activity of the heart, which is directly influenced by its anatomical structure. Misunderstanding the flow of blood and electrical impulses through the chambers and valves can lead to misinterpretation of the EKG tracing, potentially resulting in an incorrect diagnosis or delayed treatment for the patient. The technician's role, while not diagnostic, requires a foundational understanding of cardiac anatomy to ensure the EKG is properly applied and to recognize potential artifacts or abnormalities that might stem from structural issues. The correct approach represents best professional practice because it demonstrates a thorough understanding of the underlying cardiac anatomy and physiology that dictates the EKG waveform. By correctly identifying the sequence of electrical activation and blood flow through the atria, ventricles, and associated valves, the technician can better understand how these processes manifest on the EKG tracing. This knowledge is crucial for proper lead placement, artifact identification, and for communicating any observed deviations from normal findings to the supervising physician or cardiologist. Adherence to these anatomical principles ensures the integrity and accuracy of the data collected, aligning with the professional standards and ethical obligations of an EKG technician to provide reliable information for patient care. An incorrect approach that focuses solely on the electrical signals without considering the anatomical context would be professionally unacceptable. This failure stems from a lack of comprehensive understanding, which is a violation of the implicit expectation for competent practice. Specifically, if an approach neglects the role of the atrioventricular (AV) node in delaying the impulse before it reaches the ventricles, it fails to account for a critical component of the cardiac conduction system. This anatomical and physiological understanding is fundamental to interpreting the PR interval on an EKG. Similarly, ignoring the sequential contraction of the ventricles, driven by the right and left bundle branches, would lead to an incomplete understanding of the QRS complex. Such omissions represent a failure to apply essential knowledge required for accurate EKG interpretation and could lead to misinterpretation of arrhythmias or conduction abnormalities, thereby compromising patient safety and violating the ethical duty of care. The professional decision-making process for similar situations should involve a systematic review of the patient's cardiac anatomy and the corresponding electrical conduction pathway. Before or during EKG acquisition, the technician should mentally, or by referencing anatomical diagrams if necessary, trace the path of the electrical impulse from the sinoatrial SAW node through the atria to the AV node, down the bundle of His bundle branches and Purkinje fibers, culminating in ventricular depolarization. This anatomical framework provides context for the electrical events observed on the EKG, enabling the technician to identify normal patterns and recognize deviations that warrant further investigation by a qualified medical professional. Question 17. The efficiency study reveals that the EKG technician is consistently identifying specific patterns on the electrocardiogram that suggest potential compromise in coronary blood flow, but the technician is unsure of the appropriate next step beyond simply recording the data. Considering the technician's role in patient care and the importance of timely intervention for cardiac events, what is the most appropriate action for the EKG technician to take when observing EKG findings indicative of potential coronary circulation issues? Option A. Attempt to interpret the EKG findings to determine the specific coronary artery that may be affected and suggest potential treatment options to the patient. Option B. Document the EKG findings as observed and await further instructions from the physician, assuming the physician will review the tracing at a later time. Option C. Immediately notify the supervising physician or appropriate medical personnel of the observed EKG findings, providing them with the tracing for further evaluation and management. Option D. Dismiss any subtle EKG changes as normal variations or artifacts, focusing only on clearly abnormal rhythms that are explicitly listed in the technician's training manual. Correct answer is C. Immediately notify the supervising physician or appropriate medical personnel of the observed EKG findings, providing them with the tracing for further evaluation and management. Explanation. Scenario analysis. This scenario presents a challenge where an EKG technician must interpret findings related to coronary circulation without direct patient interaction or physician oversight for initial assessment. The technician's role is to accurately record and transmit the EKG data, but understanding the implications for coronary circulation is crucial for recognizing potential critical findings that require immediate attention and escalation. The challenge lies in distinguishing between normal variations and potentially life-threatening conditions based solely on the EKG tracing, adhering strictly to the scope of practice defined by CET regulations. Correct approach analysis. The correct approach involves recognizing EKG patterns that are indicative of compromised coronary circulation, such as ST segment elevation or depression, T-wave inversions, or significant Q waves, and understanding that these findings necessitate immediate notification of a qualified healthcare provider. This aligns with CET guidelines emphasizing the technician's responsibility to report abnormal findings promptly to ensure timely diagnosis and intervention, thereby upholding patient safety and adhering to professional ethical standards. The technician's duty is to provide accurate data and flag potential emergencies, not to diagnose. Incorrect approaches analysis. One incorrect approach is to dismiss subtle EKG changes as insignificant without considering the broader context of coronary circulation. This fails to meet the professional standard of vigilance and could delay critical care. Ethically, it represents a lapse in patient advocacy. Regulatory failure occurs because CET guidelines implicitly require the technician to be aware of and report findings that could indicate acute cardiac events. Another incorrect approach is to attempt to interpret the EKG findings and provide a definitive diagnosis of a specific coronary artery blockage. This exceeds the scope of practice for an EKG technician as defined by CET regulations. Technicians are trained to acquire and transmit EKG data, not to interpret it diagnostically or prescribe treatment. This overreach is a significant regulatory and ethical violation, potentially leading to misdiagnosis and inappropriate patient management. A third incorrect approach is to ignore any EKG abnormalities and proceed with routine documentation without further action. This demonstrates a lack of understanding of the potential severity of cardiac EKG findings and a failure to adhere to the principle of patient safety. It is a direct violation of the technician's ethical obligation to report potentially critical information and a regulatory failure to follow established protocols for abnormal EKG tracings. Professional reasoning. Professionals should approach EKG interpretation for coronary circulation by first ensuring the technical quality of the tracing. Then, they must be aware of common EKG manifestations of myocardial ischemia and infarction. The decision-making process involves comparing the current tracing to previous ones if available, identifying any deviations from normal sinus rhythm, and specifically looking for signs of ST segment deviation, T-wave changes, and Q-wave development. If any of these are present, the technician's immediate professional responsibility is to alert the supervising physician or appropriate medical personnel, providing them with the EKG tracing and any relevant patient information. This systematic approach ensures that critical findings are not missed and that patient care is initiated promptly, all within the defined scope of practice. Question 18. Strategic planning requires an EKG technician to anticipate potential patient complications during a diagnostic procedure. If, while monitoring a patient's electrocardiogram and observing their physical presentation, the technician notes a sudden onset of pallor, diaphoresis, and a significant drop in blood pressure, which of the following actions best aligns with regulatory compliance and patient safety guidelines for a certified EKG technician? Option A. Attempt to administer a prescribed emergency medication to the patient without physician consultation. Option B. Continue the EKG procedure as planned, assuming the patient's symptoms will resolve on their own. Option C. Advise the patient to take deep breaths and try to relax, as this may alleviate the symptoms. Option D. Immediately inform the supervising physician or qualified healthcare professional of the observed changes and the patient's symptoms. Correct answer is D. Immediately inform the supervising physician or qualified healthcare professional of the observed changes and the patient's symptoms. Explanation. Scenario analysis. This scenario presents a professional challenge related to patient safety and adherence to established protocols within the scope of an EKG technician's practice. The technician is faced with a situation where a patient's physiological response to a procedure, specifically related to blood circulation, is observed to be outside normal parameters. The challenge lies in accurately interpreting the observed signs and symptoms, understanding their potential implications for the patient's circulatory system, and knowing the appropriate immediate actions to take within the defined regulatory framework for an EKG technician. This requires not just technical skill, but also a critical understanding of the underlying physiology and the boundaries of their professional responsibility. Correct approach analysis. The correct approach, which involves immediately notifying the supervising physician or qualified healthcare professional about the observed changes in the patient's circulation, represents best professional practice. This is directly aligned with regulatory requirements for EKG technicians, which mandate reporting any significant patient distress or abnormal findings. The CET, Certified EKG Technician, certification, and the associated regulatory framework emphasizes patient safety as paramount. By promptly alerting the physician, the technician ensures that a qualified individual can assess the situation, make a diagnosis, and initiate appropriate medical intervention. This action upholds the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by preventing potential deterioration of the patient's condition. It also adheres to the principle of professional accountability, recognizing the limits of the technician's role and the necessity of physician oversight for medical decision-making. Incorrect approaches analysis. Failing to report the observed changes to the supervising physician is a significant regulatory and ethical failure. This inaction could lead to delayed or misdiagnosis of a serious circulatory issue, potentially causing harm to the patient. It violates the core tenets of patient safety, mandated by regulatory bodies overseeing healthcare professionals. Attempting to independently adjust medication or administer interventions without physician orders is a direct violation of the EKG technician's scope of practice. Regulatory frameworks strictly define the roles and responsibilities of allied health professionals, and such actions would constitute practicing medicine without a license, a serious legal and ethical breach. Assuming the observed changes are insignificant and continuing the procedure without further assessment or reporting is also a failure. This demonstrates a lack of critical thinking and a disregard for potential patient compromise. It overlooks the possibility that subtle changes in circulation can be indicative of serious underlying problems, and it fails to meet the standard of care expected of a certified EKG technician. Professional reasoning. Professionals in this field should employ a systematic decision-making process. First, they must accurately observe and document patient data, including vital signs and any visible signs of distress or physiological change. Second, they must possess a foundational understanding of cardiovascular physiology to recognize deviations from normal. Third, they must be acutely aware of their scope of practice and the established protocols for reporting abnormal findings. When faced with a situation like this, the immediate priority is patient safety. This translates to a clear protocol: observe, assess within scope, and report to the appropriate authority, supervising physician or nurse, without delay. If there is any doubt about the significance of a finding or the patient's condition, erring on the side of caution and reporting is always the correct professional course of action. Question 19. Regulatory review indicates that EKG technicians must accurately identify and report deviations from normal P-wave characteristics. During a routine EKG, you observe a P-wave that is slightly notched and appears to be of slightly increased duration compared to previous tracings on the same patient, though no other obvious arrhythmias are present. Which of the following actions best adheres to regulatory requirements and professional best practices for an EKG technician? Option A. Document the P-wave morphology in the EKG report, but wait for the physician to review the entire EKG at a later scheduled time before mentioning any specific findings. Option B. Ignore the subtle P-wave abnormality, assuming it is within normal physiological variation for this patient. Option C. Document the observed P-wave morphology in the EKG report and immediately verbally communicate this specific finding to the supervising physician or designated healthcare professional. Option D. Attempt to diagnose the underlying cardiac condition based on the observed P-wave characteristics and document your suspected diagnosis in the report. The correct answer is C. Document the observed P-wave morphology in the EKG report and immediately verbally communicate this specific finding to the supervising physician or designated healthcare professional. Explanation. Scenario analysis. This scenario presents a professional challenge because the EKG technician is tasked with interpreting a subtle but potentially significant abnormality in the P-wave morphology without direct physician oversight at the point of care. The challenge lies in recognizing when a deviation from normal P-wave characteristics warrants immediate escalation versus when it falls within acceptable variations or requires further clinical context. The technician must balance the need for accurate data collection with the understanding of their scope of practice and the critical importance of timely communication of potentially life-threatening findings. Correct approach analysis. The correct approach of documenting the observed P-wave characteristics and immediately reporting the finding to the supervising physician or designated healthcare professional represents best professional practice. This aligns with regulatory frameworks for EKG technicians, which emphasize accurate data acquisition and prompt communication of critical findings. The CET certification, for instance, underscores the importance of recognizing and reporting arrhythmias and abnormalities. Ethically, this approach prioritizes patient safety by ensuring that a potentially significant finding is reviewed by a qualified clinician who can make a definitive diagnosis and initiate appropriate management. This adheres to the principle of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach is to disregard the subtle P-wave abnormality, assuming it is within normal variation. This fails to meet the regulatory requirement for thorough documentation and accurate reporting of all observed EKG findings. It also represents an ethical failure by potentially delaying diagnosis and treatment, violating the principles of beneficence and non-maleficence. Such an approach demonstrates a lack of vigilance and a failure to adhere to the standards of practice expected of a certified EKG technician. Another incorrect approach is to attempt to diagnose the specific cardiac condition based on the P-wave abnormality without the authority or training to do so. This exceeds the technician's scope of practice, which is a regulatory violation. While the technician's role is to collect and report data, definitive diagnosis is the responsibility of a physician or advanced practice provider. This approach could lead to misinterpretation or premature conclusions, potentially causing patient anxiety or misdirecting clinical care, which is an ethical failure. A third incorrect approach is to only document the finding without immediate verbal communication to the supervising clinician. While documentation is crucial, the subtle nature of the P-wave abnormality suggests it might be clinically significant and require urgent attention. Regulatory guidelines and professional ethics often mandate immediate reporting of potentially critical findings to ensure timely intervention, especially when the technician has reason to believe the finding could impact patient stability. Delaying communication, even with documentation, can be detrimental. Professional reasoning. Professionals should approach such situations by first understanding their scope of practice and the specific reporting protocols within their healthcare facility. They should be trained to recognize deviations from normal EKG findings, including subtle P-wave changes. The decision-making process involves a risk assessment. Is this finding potentially indicative of a serious condition? If there is any doubt, or if the finding deviates from established norms, the safest and most professional course of action is to escalate the information to the appropriate clinical authority. This ensures that the patient receives timely and accurate medical evaluation and management. Question 20. The monitoring system demonstrates a subtle, intermittent downward sloping of the ST segment in lead Roman 2, which is not present on the previous tracing from 30 minutes prior. The patient denies any chest pain or shortness of breath. What is the most appropriate initial action for the EKG technician? Option A. Ignore the subtle ST segment change as the patient is asymptomatic. Option B. Advise the patient to take deep breaths to see if the waveform changes. Option C. Immediately notify the physician of the observed ST segment change and correlate with the patient's current clinical status. Option D. Reapply all EKG leads to ensure proper contact and rerun the tracing. Correct answer is C. Immediately notify the physician of the observed ST segment change and correlate with the patient's current clinical status. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in EKG monitoring, interpreting subtle waveform changes that deviate from established norms. The professional challenge lies in accurately identifying the significance of these deviations, understanding their potential underlying physiological causes, and determining the appropriate course of action without causing undue alarm or delaying necessary intervention. The technician must balance the need for vigilance with the understanding that minor, transient variations can occur. Correct approach analysis. The correct approach involves recognizing the specific waveform abnormality, e.g., a subtle ST segment depression, and correlating it with the patient's clinical presentation and other vital signs. This aligns with the fundamental principles of electrocardiography, which emphasize not just recording waveforms, but interpreting their meaning in the context of patient physiology. Best professional practice dictates that EKG technicians are trained to identify and report significant deviations to the supervising physician or qualified healthcare provider. This ensures timely and appropriate medical management, adhering to the principle of patient safety and the scope of practice for an EKG technician, which includes accurate data acquisition and preliminary observation. Regulatory guidelines for EKG technicians, such as those outlined by CET, emphasize the importance of recognizing and reporting critical findings. Incorrect approach is analysis. One incorrect approach is to dismiss the observed change as insignificant without further investigation or consultation. This fails to acknowledge the potential for subtle changes to precede more serious cardiac events. Ethically, this constitutes a failure to act in the patient's best interest and could violate professional standards of care. Regulatory failure would occur if this inaction led to a delayed diagnosis or adverse patient outcome, potentially breaching standards of competence and diligence. Another incorrect approach is to immediately initiate emergency protocols or alarm the entire medical team without a thorough assessment and correlation. While vigilance is crucial, overreaction can lead to unnecessary patient distress, disruption of care for other patients, and a desensitization to genuine emergencies. This approach demonstrates a lack of analytical judgment and an incomplete understanding of the nuances of EKG interpretation, potentially exceeding the technician's defined scope of practice and causing undue alarm, which is an ethical concern. A third incorrect approach is to attempt to fix the waveform by adjusting leads or equipment without a clear understanding of the cause of the observed change. If the change is physiological, such adjustments would be inappropriate and could mask or alter critical diagnostic information. This demonstrates a misunderstanding of the diagnostic purpose of the EKG and a failure to adhere to proper procedure, potentially compromising the integrity of the diagnostic data and violating regulatory expectations for accurate data collection. Professional reasoning. Professionals should approach such situations by first ensuring the EKG equipment is functioning correctly and leads are properly placed. Next, they must meticulously observe the specific waveform characteristics and compare them to previous tracings and baseline values for that patient. Crucially, they must then correlate these findings with the patient's current clinical status, including symptoms, vital signs, and any relevant medical history. If any deviation is deemed potentially significant, or if there is any doubt, the appropriate next step is to promptly and clearly communicate these findings to the supervising physician or designated healthcare professional, providing all relevant contextual information. This systematic, evidence-based approach ensures accurate interpretation, appropriate action, and adherence to professional and regulatory standards.